So now that you're thinking maybe a healthcare career is for you, so I just want to touch base on some of the different schooling aspects for healthcare careers. So what type of degrees are there out there? Now, there are some things that are just simply certification. Maybe it's 160 hours of training, depending on where you're going. Like maybe an EMT or a certified nursing assistant, EMT, emergency care techs. So, a diploma, that would be about a year-long program. An associate's degree is about 2 years, and a bachelor's degree is about 4 years. Master's and doctoral. Now, you can look at state schools or, universities, and they're going to offer you bachelor's degrees, master's degrees, and doctoral. Technical schools or community colleges are going to offer you the certification, diploma, and the associate's degrees. You can always search on their websites to see what kind of classes or the requirements as well. Some of the things you might want to look at is, public versus private schools. Or the new thing is, I think we see their business-oriented schools. Make sure that you pay attention to the cost per credit. Colleges have just in general increased the cost, and some of the things that have led to that is there's been decrease in funding from the states towards the schools, and sometimes just in general costs are going up, and they've turned around and put it back on the students' plates. But when you're searching for schools, looking at for schools, always look at the cost. The other thing to look at is, could I do my education in segments? So could I start with a diploma, then could I move on to an associate's degree, and would the associate's degree transfer on to a university? Sometimes that's kind of nice because then as you get your training, you can start in that different career. I think nursing is a pretty good example where you can get your certified nursing assistant, which is a certification. Then you can move up and get your licensed practical nurse, which is about a 1-year program. Then registered nurses have either an associate's degree, or sometimes they call them baccalaureate nurses, and a bachelor's degree. Back when they had something they called a diploma nurse, and those were 3-year nurses who worked in a hospital setting, but we don't typically see those hardly anymore. Then there's the nurse practitioner programs. Some nurse practitioner programs are at master's degree level, and some are moving to the doctoral degree. And it's up to the program, but I think there's kind of a push. Sometimes what we see in nature is that there is a degree push, that maybe at one time there was an associate's degree that was required for the field, and then they're moving it up towards a bachelor's degree. I'm kind of cold on that. Why should people get schooling if they're not going to use that schooling, or if it's not necessary? I think that can be kind of the challenge. We don't want people to be spending so much on their education that when they're paying back their student loans that it's not effective. And student loans, make sure you fill out, something you'll look at called the FAFSA form, and complete that and see what you're eligible for, and try not to take out as much, the student loans. If they're loans, then you've got to pay them back. But like grants and scholarships, you don't have to pay those back. Those are kind of on a need basis. So a stenographer, when you go out there and search, you'll find some associate degree programs, and you'll find some bachelor's degree programs. Make sure you visit those colleges, see what they have to offer, and take a peek and find out what's right for you. And always look at the cost. Physician's assistant, this one is typically at your graduate level. They typically want you to have a bachelor's degree in some type of health-related field. Then they have things called prerequisites that are maybe general education courses that they want you to have completed prior to entering in the physician's assistant program. And a lot of those are related to anatomy, biology-based, and chemistry-based courses. always look at the requirements for the school that you're going to go into. If you start at a different school, you'll want to make sure that your degree will transfer, or that you'll get some sort of credit for the degree that you have, an associate's degree, bachelor's degree. Sometimes you don't necessarily have to have a bachelor's degree in the actual same field. Some people have like a bachelor's degree in criminal justice and then go into social work for their master's degree. Phlebotomy, some states don't require training for phlebotomy. They'll do like on the job OJT training, on the OTJ, sorry, on the job training. Some states require certification for phlebotomy. Some places offer a 1-year program. Some people get into phlebotomy, they're like, I want to do healthcare, but I'm not really sure that I'm strong in the anatomy and med term. So I want to start at a little bit more of an entry level type position, get some experience, and then move on. And that's perfectly fine too. Know yourself.